Excellent. And as it's now 4 minutes after 1, I think I will now start transitioning into the actual conversation. So section 1, successes and challenges. Please share. What we asked people to do is, what people to do is to please share challenges your program has faced, as well as opportunities over the last couple of years. This can include items such as how you or your program are impacted by COVID-19, shifts in technology, etc. We want to hear about your successes, and please share your personal or programmatic successes. So we're going, and definitely have some a lot of challenges, but I'm sure we're all very resourceful and we have some really impressive successes we all want to share with each other. I will start off saying Vermont's experiences over the COVID response was essentially almost after getting off the plane after the national conference in 2020, almost immediately the Vermont Department of Health activated all its staff to be available for COVID response. And as Vermont's birth defect program staff consists of me, myself, and I was quickly activated into the call center. Essentially, no birth defect work was in Vermont was done for quite a while. And that would be I would be in one response, transitioned to a different part of the response, and transitioned over to another part response. And really, I had brief windows of time between to try and keep the lights on, but it's quite a challenge. And sometimes it's like all I could do is just hopefully attend a meeting a couple of times a week to get a feel for all that was going on. But I've been able to get back full time doing birth defects for a while now, and definitely I feel that Vermont has caught up a lot. So, which is like very, very pleased by the fact that I don't feel like we're quite so much under the gun anymore. And I will now open it up. Anyone else who would want to share about successes and challenges?
Hi, everyone. Hope everyone's doing well. Happy Friday. This is Iridi Nestoridi from the Massachusetts Center for Birth Defects Research and Prevention. And I mean, we faced the same challenge because we had a staff that was recruited to work on the COVID-19 response. And also at the same time, we started the COVID-19 surveillance for pregnant people and their babies. So many also an abstractor became an liaison to communicate, to educate, represent, and liaison around vaccines and testing. And so she was not available to do as much birth defect abstraction. And this could have affected our case closing, but we were actually successfully able to close for 1 more year. And also, like again, as I mentioned, several staff worked with the infectious disease lab to monitor COVID-19 in pregnant people. And this led to being able to contribute data to SETNet. And we're able also to have data to work through for some publications and public health announcements around like pregnant people at COVID-19. I know Kathy, who is also from our birth defects surveillance coordinator, is joining us today. So we are going to kind of like we can share more challenges and successes. Kathy, would you like to talk about like being able to establish more hospitals remote access because of the COVID-19 pandemic?
Yeah, sure. That's been, I think, many programs having to switch to remote access, you know, or if hospitals weren't already there, you know, trying to get more and more. So that definitely was a big push for getting some key hospitals on board. Hated to be that it was the pandemic, but that's what it was. And You know, but it's COVID. It caused those, I mean, the staff at all the hospitals, of course, were all stressed themselves, and called up for COVID duty too. So, and they were out and they were, you know, working remotely. So that just compounded it. And yeah, just in general, you know, of course, it's an ongoing thing that at the same time, all the hospitals change their systems and you know, they go to new systems and then there's delays because they can't, you know, replicate our report and you know, and so there's always, that's part of a bigger challenge all the time, but definitely during COVID, you know, I think we did expand a little to what we could do remotely for sure. And, you know, because that's the value of having good relationships, like beforehand, it kind of smoothed the way. Thank you.
Hi, I'm Julie Johnston from Louisiana. We're an active surveillance network, so we are supported. Traditionally, we've been supported by data collection specialists in each region of the state. We track children who are diagnosed prior to their 3rd birthday. So in July 2020, amid data collection staffing shortages, and this work from home mandate, our program was challenged to increase the return on investment of Title V dollars, which we're totally funded by making our data more actionable and making timely referrals to families and revitalizing our advisory board, which had been dormant for a number of years. So the whole technology thing, I think, worked very well for us. We have more participation from our advisory board because everyone's used to using Zoom these days. They don't have to travel, and docs are very busy. So that's been a plus for us. So we identified some steps to really look at every facet of our program and all of our workflows, very critically to pare down and increase our efficiencies. Some of the things were quite as simple as, our work group that we commissioned to do this with all of our veteran players and, just making a commitment to a standing meeting. So that was steady and and everything was very chaotic. That was a steady commitment. And we looked at our code list and dropped about 29 codes that through the years have been added, but were no longer reportable to any of our stakeholders. So that helped increase our timeliness and efficiencies. And we conducted an FTE study to determine our staffing needs. Rather than just replacing people in their old roles, we really critically looked at everything, timed everything out, assigned levels of complexity and to each code that we abstract. And we agreed upon a number of cases that would be submitted monthly by our data collection specialist, and that's become a performance measure. So from that, we could really calculate our absolute needs to conduct the active surveillance. And we narrowed that down to 5 data collection specialists. We have about 64,000 births annually to do the active surveillance. We have a case review coding RN who also abstracts, and I, as the program manager, abstract as well. We adopted a number of new workflow approaches. So technology helped again. All of the hospitals now submit their reports electronically in a uniform format. We set up a secure file transfer protocol site, and most of the reports go there if the hospital didn't already have their own encryption. We have large networks of hospitals in our state, but we also have a large number of very small hospitals. And so those small hospitals started using the FTP site to drop charts into us, which was a new adaptation. So now, rather than having to go to those small facilities, they're sending the discharge reports and radiology reports and those things to us electronically. And we make a cross-regional shift. So rather than having a geographic boundary for our data collection specialists, the EHRs allowed us to do this. So we have several large networks, like I mentioned, of hospitals, and all of the data collection specialists have access to those. So they're able to do their own follow-ups, even if it's outside of their region. And so we get a more complete initial case submission now, which has reduced our number of follow-ups tremendously. So we were also able to even out bottlenecks of caseloads that way among our data collection specialists. So after 20 months, we're beginning to really realize efficiencies from all of our efforts. So for the first time, we'll report data and analysis from 2 birth years in our annual surveillance report to the legislature. And then in the next quarter of this year, we will meet the national standard of reporting 99% of all our core and recommended birth defects within 2 years of delivery for the first time in our program's history. So we're very, very proud of that. And then by the end of this year, we will be having 95 to 99% of cases collected within 1 year of birth. So it's been a very successful PDSA for us. And, another thing that we can do is at any given time, we can express our number of cases within a birth year that have been identified. And therefore we can project our accurate targets for completion dates to our stakeholders. But most exciting is we're able to make timely referrals for families, and we've partnered with our Title V Family Resource Center to do this. So our data is informing those one-on-one referrals with families to get those children into, a meaningful referral that gets them into early intervention in a timely manner. And so we're excited to wrap that up at the end of this fiscal year. So in July, we can implement the pilot. We'll wrap up the pilot so we can implement that. And then the last thing is our advisory board is creating a birth defects prevention case review model, much like the mortality reviews of child death review, FEMR, and PAMR. So the purpose is to move this data to action by identifying preventable birth defects and make evidence-based recommendations for systems level changes in our state to improve primary prevention and intervention in Louisiana's maternal health system. So we have 3 frameworks to support this already developed, and we expect to start piloting our case review in October using 2016 to 2019 oral facial cleft data. So thank you.
Sounds like some things have been very exciting down in Louisiana. It's great. Does anyone else have anything to pop in they want to discuss either here, or people want to put in a quick comment on the chat? Is also great.
I mean, again, in Massachusetts, we are now trying, because of the Microsoft Access not being able to be supported soon enough. We are trying now to move our database that houses all our data into a new system. And we have started working towards this purpose by setting up meetings with the IT and trying to like show all the functions of our databases that houses all our birth defects data, and it's years of birth defects data, and also it houses our birth defects research study, and we are trying to work with the IT through into updating this into an Oracle system, and be able to have a web-based system where the data can be entered directly by our abstractors. And it's gonna be definitely be like a very, very long process, but we hope that in the end it will be a better system than the Microsoft Access that we are currently using. Kathy, would you like to add anything to that, please?
Irene. Oh, sorry.
No, I wasn't going to add anything to that issue. No, it is a big challenge, but yeah.
In North Carolina, we are going through exactly the same thing. So we have a Microsoft Access database as well that we are currently in the process of transitioning. And we also participate in the BD STEPS study. And so we have to keep that in mind too, as we want to keep all of our data flows going. So that's been a challenge for us too, but it is something we're also working on. I'll be curious to hear how the process goes for you all.
Yeah, same for you too. Like it would be good to exchange notes while we're going through this process.
Yes, definitely.
So this is Amy in Utah, Amy Nance. And while I've heard of the access challenges, thus far in our state, we haven't gotten the directives that we need to move because we are also in an access database. So definitely hearing more about how you all are doing that and the challenges you're facing. I mean, we know that we are going to have to move at some point, but it hasn't happened yet. So that would definitely be a challenge as well here in Utah.
Yeah, and for us in Massachusetts, because the database is so huge that we are using with all those years of data, and because most of us are it was very difficult to work in the database through just VPN. So we were using our desktop. So we were remote desktop into our desktops at work. But because because these were all like old desktops, that they would not be able to be supported to the Windows. An interim solution that was found is that they established for us, IT established virtual remote desktops. So now we are signing into like a virtual remote desktop, not an actual an actual desktop. So, and we are able to access the database, the Microsoft Access database through the virtual remote desktop. And this makes the work more be able to work on the Microsoft Access faster.
Yeah, definitely speed is an issue, but in Utah as well, going off the VPN, but it's working.
Yeah, here in Vermont, our system is on an Access database, and yeah, I have nightmares about one day IT saying that it has to be transferred over. But so far, they've made some grumblings, but have not said it must happen.
And then the challenges for that too, we think, well, HL7, it's an opportunity too, because you want to, kind of think about best ways to, if you're going to be changing stuff, how can it be optimized for HL7? So it's kind of thinking all about those issues as well.
You know, the argument about access is kind of interesting, and I've been in Florida now since 2008, and I think 3 different times the health department IT people have come to us saying we have to switch everything over. And every time when they actually learn about how complex our database is and all the things it does, they kind of hold up their hands and say, no, you guys are fine, just keep doing what you're doing.
That's what I'm hoping for to happen in Vermont as well. And Lisa, you wanted to share something?
Yeah. Can you hear me?
I can
Do I
indeed.
Okay, great. I never know. I've got more than one mute on my computer. So anyway, y'all, I don't know how many cases and all you have, but about 20 years ago, Texas got too big for the multiple linked access databases we were using as an interface to FoxPro. We migrated into a SQL server, what was known as the Intranet Abstraction System, and that worked beautifully for a very, very long time. However, somebody went golfing with somebody else, and they made us switch to this Oracle-based system that has been a nightmare to work with. And now, I guess maybe 5-8 years later, they're talking about replacing that. So I wish you the best. The access system was getting very ungainly and eating up tons of network space. The SQL-based system worked exceptionally well. I wouldn't advocate for what we're currently using. And whenever we finally decide what we're going to be moving into, I'll be happy to share that information with you, but I wish you all the best.
I
That's
think
good
it will
to
take a
hear
while for
from
Vermont
my end, because
to get that
we're
big.
planning to do a SQL Server migration. So we also got way too big for our access database. We actually have our case years are split up into different versions of the same access database because we have too many cases.
Yeah, we do that as well. But we just have so many different features built into the database.
Yeah. Oh, it's going to be really challenging for us to transition, but we've been told that we have to do it. So.
Hi, this is Barbara. Go ahead, Barbara.
This is Barbara from Minnesota. You know, we only started in like 2005 and we used Access until about 2010. And in 2010, we sort of somehow, as a very poor program, got queued up to be on this platform. And I think it's the same one that Texas uses. It's called Maven.
Oh God, sorry.
And yeah, but we're pretty happy with it. You know, when it was first set up, you know, we were very naive. I think none of our IT staff was really ready or prepared for it. It was a bigger investment, but we're still using it. Infectious disease uses it. Childhood lead now uses it. And so there's kind of an economy of scale that we have. It's also person-centric, the way we've built it. So addresses get updated when children get seen by other disease groups. So it is kind of, it could go badly, but it can also go fairly well. I mean, we can't compare it to anything else except for access. So it's definitely, we like it more than that. But yeah, it was hard starting out, and it's a big investment. So I'll just say that.
I will add one more thing. The thing that was exceedingly helpful is that we actually paid to have our business processes mapped. And I would strongly urge you to look at doing that before you do any migration, and to really sit down and talk to the IT people, because they don't necessarily get us.
Here in New York, we were unable to hire a business analyst to map it, so we became business analysts, even though we're research scientists. And we documented and created business requirements documents and mapped out a whole migration. So we recently also changed our database. We now have a relational database. It is on Oracle. We used to be on Oracle, so it's not too big of a change there. However, it is so nice having a relational database. A lot of things are a lot easier. We also have a completely new first effects reporting application for hospital users with the option for healthcare providers to also report to us. So that's coming down the pipeline. We haven't initiated outreach on that yet. We were able to work on and build out the new application during the pandemic. So we were very proud of ourselves there. And since we rolled it out, we've been conducting a lot of data validation and quality improvement projects. And one of our biggest challenges, just to circle back to that topic, has been hiring and recruiting a programmer. We lost our programming team with the closure of a funding period. However, we still have some funding. And we recently went through 3 rounds of recruitment and could not find a programmer that was willing to telecommute part-time. I think every one of them wanted to do full-time commuting from somewhere else and not come here. So that is a continued challenge that we're trying to brainstorm creative ways to get around. So we are pausing with having a programmer resource right now, which is a bit scary from the application side. But other than that, our team was able to function and keep the lights on quite well throughout the pandemic, even though we held many different hats with supporting different COVID activities.
Okay, Barbara, I see your hand is raised, but then after that, we might have to proceed to the next section to keep us on pace. Anyone else have a quick comment before we go on to the next section? Hearing none, I will move on to section 2, the future of the network. There are kind of 3 components of this. I think we'll probably just let it be a little bit free flow. But the 3 sections are to have in mind are: where would you like to see the network go? What would make NBDPN an organization you would stay in for the next 10 years, but besides the amazing mugs and tote bags? And what are some ideas to attract new members? Even more amazing mugs and tote bags, perhaps? Who would like to kick off?
Brennan, this is Amy. I'll just start by, these listening sessions, and I know the next topic is the annual meeting, but these times of just open conversation for the programs, I think is so important. And I think that's one thing that would help attract members, just being able to have these collaborations and communications. I mean, listening to everything that Julie has done in Louisiana is amazing. I think, one challenge in Utah, we are merging the Department of Health and Human Services, and this is bringing up a whole lot of these issues. And I think a lot of the things that Julie spoke about, and being just hearing from others how they've done it when responding to some of this. But a resource, I think, is the biggest thing for me that this network is.
Yeah, definitely. I really also really enjoy and value the times when people can talk with each other in big groups or small groups, or just really have that one-on-one or one to a few or few to one interactions where you actually can really draw upon the knowledge of all our colleagues in the network. And Stephanie, you had something you want to share?
Yeah, hi, this is Stephanie from Oregon, and sort of bouncing off of what Amy was saying is the technical assistance training opportunities, like the one that AmChip recently did for social media. I lead the social media work group for NBDPN, and I know that the people that are in that work group really got a lot out of that training. So just future trainings like that are very specific to what we're doing is very helpful. Thanks.
Very good. Thank you.
I would agree with that too. I feel that maybe if we're able in a way to have like more often trainings around like different subjects, like for example, all the CCHD and CHD like seminars were really helpful, and I think people really enjoyed them. So having more of those, and like the social media also training was really good. Having more of those, or being able to kind of maybe like find trainings that other groups are doing, and maybe advertise them through NBDPN and have the members join, can be very helpful. And in regards to expanding membership, I feel that there, like for example, pediatricians that are geneticists, they would be interested to join NBDPN, or genetic counselors. So maybe we need to advertise more to people that might not be aware of the NBDPN, but they might have an interest in birth defects. Definitely I feel there's room for expansion to to other like professionals that work in the birth defects area.
Very good. And also, like in the chat, we had Kate Alali, mentioned that like to agree about more mechanisms to share questions and responses between members. Would you like to elaborate on that?
Hi, thanks. No, I think this is a great forum. If we don't, like I said, if we don't have one already, maybe we could have some kind of mechanism that we could, share questions as they come up in our programs. I don't know if there's some kind of bulletin board that we have on the website or something along those lines, just so we can maybe share questions and answers in more real time if possible.
Yeah, that's a very good point. I mean, I thought about some options for for annual meetings, but there's some options we could maybe pursue that we don't have to wait around for the next annual or national meeting now, since it's no longer annual, to try to have more ways we can just make it very, very easy to reach out and talk to each other, especially when you don't actually already know the person well enough to just casually drop them an email or call. So something like a discussion board or some kind of messaging service, all things we can kind of explore. I'd be very interested in pursuing that.
Great, thank you. This is Julie in Louisiana, and I can't tell you over the last 20 months how many times our leadership has said, well, what do your peers do? How do they handle this? And there's not really a good way. Like, I send a group email and everybody is busy and email gets lost. So if we had a platform, that would be great. Or even a quarterly standing Zoom.
Yeah, and I also think one kind of limitation about email is some like it's hard to you only can ask people that you kind of know or support, so it's like you don't kind of expand your circle of contacts as readily when you just kind of only talking to the same old people, and also you only get the same old ideas. So yeah, some kind of service where you don't necessarily have to already be, a direct tie to someone before you, get a question asked and a good question answered, or even you see a question out there that you may not know who they are, but you're quite happy to share your response. And we have a lot of hands raised. I'm going to start off with Kim.
Hey guys, thanks. I'm really enjoying the discussion. This is fabulous. And Julie, I like the idea of quarterly Zoom calls. And I think if we can figure out a way to maybe not necessarily have them heavily moderated, but just say, hey, we're going to have a Zoom call such and such time on this topic. Please join. Please join the call. So I think that's a great idea. And I think it's something we could actually manage and do. So thank you.
And Russ?
Yeah, so, I was listening to this comment, and I think it's a really great idea. One of the things that I will bring back to the board because of this is that we might explore association management software. A number of organizations that I belong to have apps that basically deploy on the web that actually enable exactly the kinds of things that was being asked for, where our members can potentially form their own groups, or they can, search the membership and identify people who they want to communicate with, and potentially have their own meetings, hosted through a membership association membership web application. But we've never really talked about how we might try to do that for the organization. It does have expense involved, and we certainly have to review, what the pros and cons of that are. But there are some ways that are a little bit higher level than just scheduling additional Zoom calls that might actually be better for what people are asking for.
And Lisa? Okay, I think Lisa lowered their hand. Yes, lots of options here. I would be happy to start.
I'm sorry, I
Okay.
had my second mute on. I want to say that I'm a little sad to hear that people feel like they can't approach somebody else. The National Birth Defects Prevention Network is full of wonderful people who are more than willing to help. Our contact information is in the annual report or the online. You should never feel that you can't approach somebody. And we've had some other registries come and visit us in Texas and walk through our processes. So please do not be intimidated. Please feel free to contact people in the network. That's why we're a network.
Definitely want to kind of reach out and say thank you. Because remember my predecessor who kind of built Vermont's system, he credited a lot of the time he spent in Texas working with you folk is like why he was able to do what he did with like launching Vermont system. And it really is very invaluable to have a high level of interaction with people at times for like that.
Hey, Brandon, it's Kim again. I don't want to monopolize the conversation, but I want to totally echo what Lisa has said. It never, ever feel hesitant to reach out to somebody. And because a lot of folks are just, I know for one, I've worked with the Florida program for many years. And I also, when I restarted back in working with a surveillance program in Pennsylvania, I relied heavily on the folks that I knew and the contacts that I had made and who I knew to call. And Lisa, I called Texas. Back then it was Ann Phelps. I was like, Ann, help. And so, just realize there's a lot of resources out there and everyone is willing and able to share. So thanks.
Excellent. I'm going to hand off to Amanda shortly to cover the section about the national conference because we want to keep the things moving forward. Perhaps there's extra time we can always circle back, but also people can share in the chat. That's a way to kind of capture ideas, even if we're talking about something else. But I also want to say is I'm very keen on trying to do something with some kind of maybe like social type platform or something to experiment. So say something in the chat or shoot me an email and maybe we'll try to get a little at least informal work group, just kind of maybe kick around options and ideas what might work for people, because I have something that work for me, but I'm not sure if they'll work for everyone else. So I definitely want to hear, and people at different levels of technical comfort levels as well. So I definitely be interested in that, but any last comments before I hand off to Amanda about the future of the network? Hearing none, I will pass off the hot potato to Amanda to talk about the national conference.
All right, thanks, Brennan. hoping to have as exciting of a discussion about the national conference as we have so far. For those of you who don't know, the national conference will be in Atlanta next March. We're all very excited to finally be back in person together. So we're hoping to get some great ideas for the conference. I think the first thing to start off with would be, for those of you who have attended the last conference or previous conferences, what was your favorite thing or least favorite thing? And also ideas about plenary or training sessions that you would like to see. I think one session that we've discussed a lot that I think feedback would be great on is the morning session of genetics that is for a couple hours. We've gone back and forth about whether we thought that was still informative and relevant to our members. So we look forward to hearing your ideas.
Hi, this is Jing from New Jersey. NBDPN have a lot of great publications. I wonder in the conference if people which already published the paper can present the process, how they analyze the data and can share some source code. That's my hope for the for like a training section for that kind.
Yeah, that would be great, like somewhat of a mentoring session. I definitely think we're trying to incorporate ways like we're talking about right now to learn from each other in person also at the annual conference. So that's a good idea.
Yeah, I hope to have like a whole process, say this paper, is already published. Like what's the idea like from the beginning, and then how to do the data analysis is kind of like with the expertise of those already published the paper can map the the roadmap. Thank you.
Okay, thank you.
This is Irini from Massachusetts. A general idea. I'm not sure logistically how this can happen and if it is easy to happen. I was wondering if this can have also, the conference can have a virtual component, because many programs are like state-based programs, so there are a lot of like procedural issues for everyone to be able to participate and go in person. So maybe a virtual component will allow many of the people that will be not be able to travel and meet in person, which is always great. But to be able to participate and also be part of the conference.
I second the virtual as well, maybe just for some certain sections. Just obviously with state budgets, not everyone can attend, but I do think that it's really important for others to hear the messages.
This is Barbara.
Sorry, throw out the sort of the next while we're talking technology and virtual. That was another aspect we wanted to ask about is, what technologies for presentations and conferences have you seen in the past that really worked well? Since a virtual component would obviously require some sort of virtual platform. Kim, you had your hand up, and then Barbara.
Yeah, hi. I think having a virtual component of the conference is very important. It's also, and I don't know if we'll be able to do it, but we also be nice to have selected presentations recorded and have a presentation on demand set up for folks. So I think there's a lot of, again, with the new technologies and more people engaged in new technologies and the use, I think it's going to open up opportunities for share not only the actual conference experience, but conference content afterwards. So fingers crossed we can make that happen.
I would agree. I mean, I know that sometimes when we go on site, you're really torn. Sometimes you have to present at one conference, you're missing one of the key things that you actually were really excited about hearing and participating in. So a recording would be great. one thing that I've heard from some of my staff, we usually try and have a good balance of like an epi go and a abstractor go and a reviewer go. And sometimes there's not enough for, people that are more focused on data collection. And I have heard like, a lot of like some aspects are just, they don't feel like it's their work. And so it does make it hard for them to want to go, and travel. And so I'm not sure, it does make it much more complicated to do different tracks, but we do learn so much from just hearing how other states do things like hands-on, like how it actually happened and the ins and outs, that I think that that's just always a need. And I would like to see more of my abstractors, be able to interact with other states and learn. So I'm just kind of speaking to that side. I think we do a good job of big picture and data utilization and what's going on with the research, but sometimes the data collection, there's just a couple, not maybe enough to get people on site. I'm not sure if other people agree.
Barbara Kim again, I completely agree on that. So I think that is something we do need to maybe, and I don't know, again, tracks, we've talked about a little bit, bounced around, but I think it's definitely important that we spend get our data collection folks, I mean, because they're where the rubber meets the road. So great, thanks.
I would say, I don't know if you have any feedback on, so the genetics section is one thing we went back and forth about, whether that was, very geared towards abstraction, and we don't do a lot of genetic abstraction in Florida. And we were unsure how many states still focus on that, and if that's still, a main component for the abstractors or data collectors for the national conference. And then Dominique, sorry.
Yeah, we do abstract several genetic codes, and they're always difficult to pinhole, to get coded. And so I know that our case review coding specialist is an RN. We have access to geneticists on our board, but she is always asking for a platform to be able to ask questions back and forth. And so I think it also helps our abstractors as well.
And this is Kathy from Massachusetts. It's such a changing field that you do benefit, like especially at that kind of meeting with the latest, to the new testing and the new genes that are identified. If you're talking just genetics, I know they also, are you talking about the embryology section too, that was always a component, or just the genetics part? But genetics definitely, I would say, worth it. So much is happening so fast in that area.
I would also say that in our state, Medicaid is now paying for, microarrays and genetic testing. There's actually a bill in our legislature is in session right now for, I think they labeled it critically ill to undiagnosed children to have genetic testing. So whether that goes anywhere within the legislative process or not, there's some traction in our state for funding for genetic testing that hasn't been present before. So I expect we're going to see, maybe every kid that we look at is going to have that information.
Dominique, did you want to go?
Sure. I have zero qualifications to talk on genetics, so I'm going to go back to the virtual idea of virtual sessions, just a smidge, and maybe this overlaps in some ways. But I know that when we had talked about some ideas in the data committee, someone had mentioned, and this has really stuck with me, that like for presentations, sharing results, things like that, virtual formats work really well, actually, to just give a presentation of like, here's what we did, here's what we found. And that maybe we could do something where we somewhat flip the conference, sort of like flipped classrooms, where you have those presentations available ahead of time. And then when we gather together, we can go into more deep discussion on some of those things to sort of follow up further from them. And so that the time isn't spent as much on presentations, but on discussion. But that would also make those presentations available to people who couldn't come in person.
Julie? Oh, those are claps. Yeah, I think that's a great idea. And I don't know if it would be, specific topics that we definitely want to do that for, because I don't know if it would work for all sessions. And obviously for those, the presenters would have to record them, before the conference, and then we would have to give members time to review them. But I think that would spark some really great discussion instead of just listening for all of the sessions. Are there any ideas about training session topics or specific topics you'd like to see aside from those specifically for data collectors or abstractors?
It's Jing from New Jersey again. I hope to see kind of like a training section of the, most, I'm an epidemiologist, so it's from that point, it's the top 10 most popular analysis area in this field. Like, for example, social determinant of health. Like, maybe we can have a survey first and then determine the top 10, and then people can have a general idea what's the, the most discussed or most interested area in this research field. From analysis point of view, maybe we are interested in prevalence. We always for this network, we always interested in the birth defect prevalence. But is there any other area we are interested, like quality of life or like health resources use? Like, what's the most discussed and the members from the whole members interested area? I hope to know and broaden, my knowledge, and also see if our program can contribute to this.
Thank you. So our other questions we had about the annual meeting to keep the discussion going would be, what meetings do you look forward to attending each year? What makes them different from others? And if you had to choose one meeting to attend for the year, how would you select which meeting to attend? And this is closing out our questions on the national conference. So any other feedback you have, now's the time.
Hey, this is Julie. For several years, I attended AmChip every year, and seemed to be very well-rounded and something for every one. I wonder if funding is an issue to go to different meetings, I wonder if there's a way to partner with AmChip to get more birth defect surveillance sessions at AmChip. And, I'm Title V funded, so I'm coming from that perspective.
I would second Julie's comment. We're also highly Title V funded, and AmChip and NBDPN are really the only two meetings that we usually do get to attend. So if they could piggyback on each other, that would be really great.
Russ, I think you have your hand up, and then Kim.
I wouldn't be surprised if Kim and I will say pretty much the same. I'll go ahead and start out. So definitely we have in mind to using our stronger partnership with AmChip to do this kind of thing. And I don't think we've explored fully exactly what the best way to do it is. And it's not just about annual meetings. It's also about, you know, other activities that AmChip has. They have all sorts of working groups and projects. And there definitely are ways that NBDPN could potentially partner and get more involved in those kinds of things. And we had planned to be doing something, well, I guess it would have been last month if the meeting had actually happened last month, you know. But it's definitely something we have in mind to use our stronger partnership with AmChip to you know, provide more opportunities for projects, and also to expand the connections between state Title V programs and their birth defect registries. And I'll let Kim say if she wants to add anything to that.
Yeah, I'm going to echo what Russ says. Is we have, you know, created and developed a very, and continue to develop a very strong partnership with our AmChip colleagues. First of all, Justin is a result of us being able to leverage a cooperative agreement funding from AmChip and having someone to help support us and being more kind of day to day. But I think long term, we really want to understand how we can leverage both our relationship with AmChip and what AmChip can also learn from NBDPN. So I think, don't be surprised if maybe we have something like that at the 2023 national meeting, but it's definitely, as we begin, I think, working more closely together, there's a tremendous amount of opportunities. And Kate, I didn't know, Kate Taft was on the call. I don't know if Kate's still with us. Kate is with AmChip. Kate, anything else you'd like to add?
Hi, yes, I am still here, and this has been wonderful to hear and appreciate everyone's comments and feedback. But yeah, I would just echo, I think that, you know, we're really hopeful to be able to leverage our partnership and learn from you and work with you as well. So these are a lot of great ideas, and I know we have a lot of plans to go through and figure out the best ways to do that.
Okay, great. So if there's no other discussions about the national conference, we were just going to open it up for any other topics that we did not discuss today that you all would like to. Okay, hearing none. I think this has been a great listening session. Thank you, everybody, for participating. We did record the session, and it will be made available to all of our members, so you can refer back to it if you'd like to. And thank you all for joining. Have a great weekend, everybody.
Thank you so much. Have a great weekend too.
Have a good one.
Thank you, everyone. Appreciate it. And Amanda, Brennan, thank you again for moderating. Have a good day, everyone.